All right, I think we begin. Good evening to all of you, and a very warm welcome as well to Kamalaya. And such an honor, seriously, absolutely, Dr. Ashley Berry. Thank you so much, first of all, for agreeing to come here and do this talk. And fortunate enough, there's a lady who knows you. She's heard your lectures in the past. And just to put things in perspective, I was like, oh, I was born and Dr. Ashley was graduated. So been 45 years you've been practicing.
47.
47. There you go. So absolutely honored to have you here. And it's such a fascinating topic because I think, Kamalaya ethos were always on prevention and, educating the client base to ensure that it's not only that you come here, you do your stuff for that 10 days, 2 weeks, 3 weeks, 4 weeks, and then you go back. But it's really the tools that you take with you, and we've been doing for years. And through that practice, the Kamalaya conversation was the thought where we bring specialists from time to time to discuss on varieties of topic. We believe that Kamalaya, that the true well-being is not only about the body, but also about nurturing the mind. And hence, through the discussion with Dr. Ashley Berry, we thought that it's good to create awareness, to improve people's skill in understanding, because we hear so many people who says, oh yes, my father has, my grandfather had, my mother has it, and we just take it for granted and we move without taking any proactive actions in this field. Our brain is at the heart of how we experience the world, but we, again, as I said, that we take it for granted. How we remember, connect, create, and live with vitality, rather than accepting that, yes, one day I'm going to have that and it's part. Yes, maybe through the genes, all of that kind of stuff, you're going to have it, but there is always a way, to ensure that you still have a better, prolonged, and a health lifespan rather than just living somewhere on the bed. And today's session is an opportunity to deepen our understanding on how conditions like Alzheimer and dementia develop, and more importantly, how lifestyle, which is very much like a Kamalaya lifestyle practice, awareness, and early attention can make a real difference. And by coming together, we're going to be learning some skills from Dr. Ashley Berry. So please allow me to hand over this, and thank you again for being here today.
So I'm a GP from Sydney. I'm what's called an integrative GP. And for people that don't know, Peter asked me, what's an integrative GP? So if you went to your GP with blood pressure, he would give you blood pressure tablets. But if you came to me with blood pressure, the volume seems to be varying a bit. Yeah, so if you come to see me, I need to know why you got the condition. So for example, I used to be a chronic fatigue doctor, but these days I've become more of a cancer doctor. And when someone comes to me with cancer, I want to know why they got the cancer. I'm not just treating it. So it's not just the condition. We want to know the terrain, the background. Why did this happen? So with dementia, there are a lot of factors we can look at. So we're going to go through the different types of dementia. I can only have time to speak about 2 of them, but they're the 2 commonest causes. A few tests that you can do. A very simple test you can do on the internet, a free test. It's a memory test. It's quite accurate. And I have to admit, this information is not my information. Okay, I'm a bit of a copycat. This is from an American doctor. Most of the integrative nutritional medicine has come from Americans because these guys have got so much money, they do all the research. And we kind of suck it up. But this is written by a very clever guy called Dale Bredesen, who started life as a researcher. And then he realized that people are not going to take him seriously if he was just a researcher. So he actually went and did medicine. So he's a researcher plus a doctor. So he's got lots of credibility. And please interrupt, because if any question you ask, there are going to be at least 5 people that want to ask the question but are not game enough to. So I'm going to go through this very quickly. There are 2 versions. Even though this is a quick version, I'm going to skip through quite a few slides, but there's a much longer version with lots of references. So for people that actually want to look at references, this is all evidence-based. Okay, so most of this is going to be about Alzheimer's. Some of it's going to be about vascular dementia. We're going to skip the others. Now, just got a pointer here. Now, this is really important because certainly in Australia, the moment someone gets constipated, they put them on these osmotic laxatives like Movicol. This was a very big English study. Oh, I took the study. Oh, no, it is there. More than 500,000 people. And it showed that using osmotic laxatives increased all forms of dementia. So we should not be using osmotic laxatives. If you do, you might use them for like 3 or 4 weeks. So for example, I had a specialist give us a big lecture about a year ago, and she would use colonics to clear the bowel, which is great. A specialist in Australia using colonics, it's quite amazing. But then she would put them on this horrible Movicol. You know, you've got so many other options, psyllium husk, so many different kinds of fiber. Okay, so these are the kind of people that get Alzheimer's. So you're really stressed, you work back late, then you have a late night snack. The moment you snack late at night, that increases your cortisol through the night. Cortisol increases insulin. Insulin makes you fat, and insulin stops you breaking down fat. So insulin is something we want to keep in the right level. Now, particularly if you're not sleeping properly, and from the cortisol, you get quite a lot of inflammation. Now, stress particularly damages the memory center, which is called the hippocampus. And these days, the Americans have actually got a fantastic form of MRI called a neuroquant that actually measures this area and compares it to other people of your sex and age. So you can actually see, is it shrunken or is it swollen? Going to bed late at night. So how many of you go to bed before 11? Can you put it? Wow, it's pretty good, pretty impressive. So the quality of sleep before midnight, like 2 hours before midnight, is equal to 4 or 5 hours after midnight, because we go into a really good deep sleep when we go to bed before midnight. So ideally, in an ideal world, which of course is difficult, but you want to go to bed when the sun goes down and get up when the sun comes up. But even if you go to bed by 10 o'clock, that's usually not too bad. Sleep apnea is very common. Now you're going to have men get this more than women for some reason. Perhaps, you know, the big stomachs as men get older. And so if you've got a spouse or a partner or someone who you know who kind of snores, and then they stop breathing for 20 or 30 seconds, and then they give a grunt, and they wake themselves up, and then starts breathing again. That is classical severe sleep apnea. I've got a little device that can actually help it. Alcohol is quite, we'll talk about alcohol later on, but alcohol increases visceral obesity. It increases memory loss directly. It's actually not so much an Alzheimer's type of dementia, it's another form of dementia. Now, juices, vegetable juices are incredibly healthy, but unfortunately, fruit juices are not. The fruit we get these days is Frankenstein fruit. It's not real fruit. So when we had pears years ago, like hundreds of years ago, pears were about that size. And of course, now they're much bigger. And everything has been not so much genetically modified, but bred to be bigger and sweeter and have more fructose. So if you eat fruit with its fiber, that's really healthy. But when you drink the juice, so for example, orange juice particularly is incredibly, really raises your sugar, raises your insulin. Whereas if you ate an orange, that's much, much healthier. So the fruits that are particularly low glycemic load. So the old doctors used to talk about glycemic index, but glycemic load is much more important. So if you look on Google, there's lots of lists of glycemic load. So in the Asian fruits, particularly watermelon and papaya have got quite low glycemic loads. And generally all the berries and cherries tend to be low glycemic loads. And I think kiwi fruit is too. Okay, now I'm not sure if any of you are on acid suppressants, but anything that suppresses your acid long-term is going to kill you earlier. Your risk of dementia, pneumonia, everything is significantly increased. You can get all these slides from Gopal if you want them. Okay. So once you put someone on an acid suppressant, you stop absorbing minerals, particularly something like zinc. And zinc is so crucial for immunity. Once your zinc is reduced, you're likely to pick up infections, pneumonia. In fact, the moment I have someone getting recurrent infections, it's one of the first things I do. I check what's called a 24-hour urine zinc. And in Australia, that's actually bulk pool. It's a simple test for me. So once you're on these acid suppressants, risk of fracture, so many different things. Now, I'm sure there are some of you on statins, and there are probably some people that actually need it if they've actually definitely had a heart attack, have stents, for example. Those people do benefit from statins. but 90% of people that have statins don't actually need it. And Bredesen in his book, and particularly in chapter 8, says if the cholesterol is very low, that significantly increases your risk of cholesterol. Now, people don't realize, but you need fat. So your brain is fat, your liver is fat, and cholesterol makes a lot of hormones. Okay? So cholesterol makes testosterone, it makes estrogen, it all comes from cholesterol. So if we bring the cholesterol down too low, we're not going to make these very important hormones that build muscle. So as we get older, we all tend to lose muscle. So women will do it after the menopause. Men tend to do it about 10 years later because we've got a bit of testosterone. But losing muscle is a big disadvantage. And when we bring down this cholesterol too low, we're going to do that. We're going to increase this thing called sarcopenia. And particularly with these statins, I can promise you, I have never heard a cardiologist say to someone, when I put you on the statin, it's going to help your heart, but in women, it's going to increase your risk of type 2 diabetes by 50%, 50. Now, the second presentation has got all the references for this, so I'm not kind of making this up. Okay. For example, if the LDL is below like about 2.4, that is considered very, very low. So if you've actually got a stent, or if you've had a heart attack, keeping your cholesterol somewhere around 4 is considered reasonable. But some of them will now want to drop it down to 3 and 2.5. That is crazy. It is very good for the heart, and cardiologists only know about the heart. In the old days, certainly in Australia, we had these things called general physicians who were specialists on everything. But now medicine has become so complicated, there's no such thing as a general physician. So that cardiologist does the heart, someone else does the gut, someone else does something else. And we're all kind of divided in these little pieces, and no one looks at the whole person. And that's why an integrative GP can do that. Okay, gluten, of course, is quite toxic for a lot of people. We talk a lot about food intolerances. Now, if you think you might be sensitive to something, I could spend like $500 doing a food allergy test, but it's much easier to go off that food for, say, 3 weeks or 4 weeks, and then reintroduce it and see what reaction. Now, particularly with gluten, a lot of people will get joint problems. Some people will get brain fog. Gluten, even though people talk about dairy causing a runny nose, gluten itself can cause a runny nose. Some people will get constipation, diarrhea. So the thing is to go off that food, then reintroduce it and see what happens. That's called an elimination diet. Now, interestingly, 80%, so Australians eat a lot of fruit, which is high in fructose, does lots of damage. But 80% of us don't eat enough vegetables. In America, it's 90%. And in Thailand, it's also very high. 74% don't eat the recommended amount of vegetables. In the elderly, almost every country, elderly people, when I say elderly, I'm looking at, say, someone over about 65, they need to eat a little bit extra protein. Not only do they need to eat it, they need to absorb it, and they need to do some resistance exercise. So I noticed those Pilates reformers, that's a very simple resistance exercise, but even going to a gym, but any kind of exercise will help. Now, when you run, when you swim, that's an aerobic exercise. It's really good for your brain, but it does not build muscle. Each time you go for a run, you break down muscle. You only build muscle when you're doing resistance training. So you've got to go Pilates reformer, maybe some kind of TheraBands, some kind of weights. You can even use your body to do kind of weights using your body weight, for example, for your legs. We all know how bad antibiotics are. But in Australia, a lot of our food is allowed to contain antibiotics. And again, I've got a reference for that. Quite crazy. Okay? And some of these antibiotics are quite strong. Now, we worry about fats, but the main thing we need to worry about are these things called trans fats. So once an oil is being reheated, the structure changes and becomes a trans fat. So these are the next lot of people that get Alzheimer's, particularly people that are smoking. Smoking really consumes all your antioxidants. It has about 400 things that cause cancer and about 1,000 things that are harmful for you. And vaping is not much better. Vaping is slightly better, but the problem now is because vaping has become so trendy, people that wouldn't be smoking are now taking up vaping. Now, dental health is very important, particularly in regard to Alzheimer's. You must get your teeth cleaned regularly. And when I say regularly, at least every 6 months. So for my cancer patients, they get their teeth cleaned by a dentist every 3 months. And we should all be flossing pretty regularly. Cleaning with a toothbrush is not enough. Are you okay? I'm not going too fast? Yeah? Okay? A little bit fast. Slow down a bit. What I've done, everything I'm saying though is on the slides, but I've got so many slides to go through that we're going to be here till 8 o'clock. Now this thing, BDNF, stands for brain-derived neurotrophic factor. It's something that builds new brain cells. So the moment you exercise, you actually increase BDNF, and there's a whole range of things that increase that. Exercise, curcumin, socialization, aerobics, all of those things. Head trauma is a big one for dementia. Okay, so one of the commonest symptoms there are 3 types of Alzheimer's. This is the first one. Symptoms are, in this group 1, the classic symptom is loss of facial recognition. So if you have a relative and they're seeing, I don't know, their chiropractor in a shopping center and they fail to recognize the face, that is classical. And that's that big medical word. We don't use simple words in medicine. We're going to make it complicated. So that means it's very specific, prosopagnosia. It's a classical early Alzheimer's sign. Mental fatigue around the afternoon is very common. So these are all things you can read up. Mixing up words, reduced processing speeds. So these people in group 1 also have a lot of anxiety. Now, we have lymphatics that take blood and clean it out, go through our lymphatics, through our lymph nodes, through our spleen. But the brain has this thing called the glymphatic system. And when you sleep deeply, that works really well. And the important with the glymphatic system, we've now discovered, if you sleep on your side, it clears the brain much better than if you sleep on your back. Someone has now suggesting, there's a Dr. Sarah Myhill from England, UK, who's suggesting that if you raise the head of your bed 4 or 6 inches, then that also helps. Now, I'm not suggesting everyone do it, but if you've got a family history, then these little tips become very important. Now, this is a test that can be done to diagnose Alzheimer's. It's called a MOCA test. But what I want to show you is particularly this one. That's the free test on apollohealth.com. So that's, again, an American test. It's free. There's about 3 or 4 different versions of it. And one test is not going to help you. You really need to do the test, repeat it in a year, and see if there's a change. And particularly if you've got 3 successive tests getting worse and you know you've got a problem, please try and act on it earlier rather than later. Psychologists can do this thing called a neuropsychological assessment. I don't want to talk too much about the neuroquant because you only get it in America. Even in Australia where we get it, it's very expensive. It's about nearly $1,000. Now so MOCA is the one done by a psychologist. Okay. Now this is very exciting. Unfortunately, this is not yet available in Australia and most countries. It's only available in America. Are there any Americans here? Yeah, so this is only unfortunately available in America. It's about a $400 US test from what I understand, but it actually predicts it. It's amazing. So there's these 3 different tests that Verizon has now designed that are very specific for Alzheimer's. Okay, the neuroquant. Basically, it's showing which parts of your brain. So the hippocampus is the memory center. It'll show you whether it's shrunk. So if it's below 30%, that's shrunk. If it's inflamed, then it'll be very, very swollen. So both of those are bad things. I'm going to skip through that. Now, this is a test. Anyone who feels they might be getting a memory issue, this is a genetic test, and it's the most important genetic test in Alzheimer's. So if you get a gene from both parents, that's called homozygous. If you get it from only one parent, that's called heterozygous. Okay? So homo is the bad one, hetero is not quite so bad. Now, if you get it from this ApoE4, that's what it's called, ApoE4, this genetic test in the blood, it shows if you get this from both parents, there's nearly a 90% chance of getting Alzheimer's, between 50 and 90%. If you have ApoE3, the risk is something like 9%. And if you have ApoE2, it's actually very protective. But this is very, very few people have that. So most of us, when we do the test, it's usually ApoE3. Yes, please. Under what circumstances would you recommend someone do this? So particularly if there's a family history of the spouse tells you they're starting to lose memory. Anyone with heart problems. So this not only damages the arteries to the brain, but also damages arteries to the heart, arteries to the legs. So anyone with any kind of vascular issue should be having this test done. Now, unfortunately, when you're a doctor and you see so many sick people, you become a bit of a hypochondriac. So you start doing all these crazy tests on yourself first. And I did my test, and I was luckily an ApoE3. So it's a slight increase, but not major. This is a really good website. It's actually written by someone who had dementia, and Bredesen reversed it. And then this lady set up the website. So this is quite amazing stuff. We can now reverse dementia. Don't be scared. Okay, so these are the three types. The first type is inflammatory. Now, a regular doctor will tell you heart disease is caused by cholesterol. I'm going to tell you that heart disease is actually caused by inflammation. And how do you know if someone has inflammation? You just measure their waist-hip circumference. And if that ratio is greater than 0.9 in a man and greater than 0.8 in a woman, they've got inflammation. So visceral obesity is the first sign. And then you can do blood tests, a special ESR, HSCRP, which a regular doctor knows about. The second one is things that are missing. So often due to low hormones, for example. If your hormones are low, as I'm getting older, I actually use testosterone, but I use it as a cream. Now, I'm not using it for sex or anything like that. I'm using it mainly to keep my brain cells working properly. Because when men get past about 60, their testosterone really plummets. And even with women, if you give them hormone replacement straight after the menopause, you actually preserve their brains better. But that's a different topic. I don't want to go there today. But I've put this in red. So this is a toxic protein that I can promise you, most of you, your doctor has never checked. Has anyone had this test done, homocysteine? Have you heard of it? Yes, no, you had it done. And can you remember the number? Okay. So in the metric system, I'm sorry, I don't know the American system, but for the metric system, which the rest of the world is, the number needs to be between 7 and 8. So this is a toxic protein. When it's very high, it causes dementia, increases your risk of stroke, increases your risk of cancer. So this is more, for me, this is more important than cholesterol. And what brings it down is a combination of B vitamins, particularly B12, folate. Quite often that will bring it down. Are you okay? Yes. We've only just started, darling.
You were talking about the ratio of hips to waist.
Yeah, so the waist-hip ratio for a man, once it's greater than 0.9, so comparing the waist to the hip, that's significant. And for a woman, greater than 0.8. And I have a feeling that when you go for your bioimpedance testing here, they do something like that. But instead of doing waist, hip, they do your height and your waist. Once your waist should be 50% of your height or less. Once it's more than 50%, that's significant. But that's a different way of looking at it. I think the waist-hip ratio is considered to be more accurate. Now, this third type is like a toxic type, and we don't have time. This is a really complicated one, hard to reverse. So we now know that in some people, mold sensitivity, so 20% of us that are exposed to mold, and the mold is often not obvious. In Australia, in the last 20 years, there's been a building boom, and 99% of our buildings are built so badly that they leak, and there's mold, and it's hidden. So we have these special people called building biologists who come and inspect the house, and they can have all these fancy meters and actually see mold behind the wall that you can't see. So it's certainly worthwhile if there's a mold issue. And the time you suspect mold is if you go into a room and get a musty smell. If there's ever been a flood, so if there's been a flood in the bathroom, in the kitchen, in the laundry, most of the time there'll be some water damage. It must be checked. Another subtle thing is to look behind pictures on a wall or behind a sofa. If it's getting a bit of mold there, sometimes you see it there. And leather shoes or leather jackets in a wardrobe, if they start to get a bit furry, you've got mold in the house. And if someone's getting a memory problem, they must not clean the mold because it's just going to make them much worse. So someone else has to clean it. Now, luckily, we don't have this problem in Australia, but in America, when they do brain biopsies, 90% of people with Alzheimer's have evidence of Lyme disease, L-Y-M-E. 90% of brain biopsies have Lyme disease. Okay, have you heard of Lyme? It's basically given by a tick. And the problem is when the tick bites you, you don't usually get just one infection. You get Lyme plus all these different co-infections. There's Babesia and Bartonella and blah, blah, blah. There's many different co-infections. In the old days, we'd be putting these people on antibiotics for years, but now we've got lots of herbal equivalents that are certainly safer. But we're not going to look at that group today. Okay, so the first, let me go back to that first group. So the waist-hip ratio, and if your waist-hip ratio is increased, you need to get your doctor to check you for diabetes, but before diabetes, there's a condition called insulin resistance. In pregnancy, they do something called a glucose tolerance test. So my test is very similar, but instead of just measuring blood sugar, I'm measuring insulin and the blood sugar. Okay? Now this cold type, the one associated with homocysteine, low hormones, that tends to occur a little bit later, 10 years later than the type 1. And they also lose, so with Alzheimer's, the classical Alzheimer's is to lose new memories, but these people lose new memories and old memories. So for these people, you need to check their thyroid, check their adrenals. So anyone who's stressed, there's a thing called cortisol, and when let's say you get pneumonia or someone dies, your cortisol goes up for a week or so and then it comes down. But if you've been stressed for a long time, that cortisol nosedives and it gets very, very low. And it stays low until the problem is solved. So if you've got someone with, a new baby that's not sleeping, anyone who's got, 3 or 4 kids, husband's not very supportive, these people are going to have a lot of adrenal stress. Their cortisols go really low. Now, vitamin D, if there's one thing you learn from today, get your homocysteine checked and please get your vitamin D checked. There is a big difference between normal and optimal. So normal just means you're in the range. So for example, in my lab, the range for vitamin D is 50 to 140, and my colleagues will say 51 is normal. But I want my patients to be well over 100, and if they've got cancer, I want them to be at the upper end of normal. So for the good things, you want the range to be high, not out of the range, but in the upper end of the range. And with something bad, you want it in the lower end of the range. Now, the big thing about vitamin D, it maintains synapses. So where the nerve goes, and it goes to the muscle or it goes to another nerve, that little connection is called a synapse, and vitamin D is very important for that. So we want a really good level of vitamin D. Okay, we're going to skip this one because this one's a little bit harder. But these people tend to get depression, trouble with attention, and they get atrophy in many areas. Anyone got black fillings? No one's game enough to say. Anyway, if you've got a black filling, I seriously recommend you take it out. So black fillings are half mercury and half something else. They're called amalgams. And the moment you eat, the moment you drink something hot, that stuff leaks out of your teeth. It's called the elevator to the brain, so it goes straight through your nose into your brain. So black fillings should not be used. And holistic dentists, like I'm an integrative doctor, holistic dentists don't use mercury anymore. I've talked about the lymphatics. So sleep on your side, raise the head of your bed slightly. Okay, so this is very interesting about coffee and tea. So people that drink some coffee, it certainly helps them, but once they're drinking more than 4 cups a day, that's really bad. And when I'm saying coffee, I mean machine coffee. Instant coffee doesn't work. Okay, instant coffee is quite toxic. And if you've got decaffeinated, it needs to be extracted with water. Some of them use some kind of chemical to extract the coffee. Tea also has lots of antioxidants in it, and even high levels of tea can be quite useful. Okay, now this is interesting. So nicotine has helped COVID. So people with chronic fatigue with COVID, nicotine helps them. So I'm not suggesting that they should smoke, but if they use a nicotine patch, a percentage of them will actually feel significantly better. And nicotine does help the brain, and nicotine specifically helps Parkinson's disease. We're not quite sure why, but maybe it's making the nerves jump better. Okay. So the treatment of Alzheimer's, if you've actually got it, I'm going to skip through this a bit because you don't really need to know the treatment, but it's basically a high-fat diet, dental checks, make sure you've checked your teeth for mercury amalgams, make sure you're detoxing. So all of us need to detox every day forever, okay, because we're all toxic. The biggest thing that's going to help you is to get rid of non-stick. The stuff that's non-stick, it's found in baby's cord blood. So it gets through the placenta into the baby. So you can imagine what it's doing to us. So all these hormone disruptors, plastics can be in makeup products, they can be in shampoo, lots of things, nail polish, Glad wrap, the cling wrap. You really want to be staying away from plastic as much as you can. So look for chemicals, mold, EMF. Always check. So for checking vitamin B12, you're going to measure that test I mentioned earlier, homocysteine. Because when we measure just the B12, it tells us what's in the blood, but it doesn't tell us what's inside the cell, whereas the homocysteine is a measure of how that B12 is working. So it's a much more accurate measure. And I talked about the insulin resistance, the hip waist ratio. Now, this is another big tip of mine. If anyone is snoring, if their sleep apnea is mild or moderate, this device is called Power Breathe, and it significantly helps sleep apnea. So it's like a Ventolin puffer, but instead of squirting something, you're going to blow into this thing. So once you blow into this little device there, you do it like 15 times in the morning, 15 times in the evening. It's an exercise for your trachea, because what happens with sleep apnea due to alcohol or a big stomach, this muscle actually collapses, and this makes it much stronger. So for the mild to moderate sleep apneas, it can help significantly. This is not the thing you use for chest infections. So chest infections, I think you're sucking in. You've got those three little, this one you're blowing into it. And it's actually got a little dial at the bottom that you can tighten up as you get stronger and stronger. Now, once you've done this for about 2 months, most people don't need to do it after that. They can do it maybe just 2 or 3 times a week. They don't have to do it twice a day. I'm going to skip this because this is really for people that have actually got Alzheimer's. Okay, so these are all the different supplements that help. There's a lot of them there that are there. Anyone who drinks any alcohol, thiamine is very, very important. So most doctors know about thiamine. Most doctors don't know about benfotiamine, which is a much more active form. But the Americans now have this even better one called TTFD. I won't tell you the name, but it's a much better form of thiamine. It gets into the brain, it works really well. Now, I briefly want to touch on this down here. Once you're past a certain age, so if you're 30 or 20 and you have your appendix out, you're going to recover from that pretty easily. But once you're past about, say, 60, 65, when you have a long general anesthetic, a percentage of people will lose memory and it does not come back. Okay, so once you're over 65, if you're already a bit frail and you have a long general anesthetic, for example, bypass surgery, hip replacement, knee replacement, hip replacement, all of those things, you can lose memory. And there's, again, a protocol that most naturopaths can give you to try and prevent that. Sorry? It does not. You still lose memory, unfortunately. So in Australia, in a kind of very geriatric hospital where a lot of the war veterans used to go to, they discovered this 25 or 30 years ago, but no one did anything about it. But more and more doctors are seeing patients having these long anesthetics, and their personality changes, they lose memory. And if we give them B vitamins beforehand, give them zinc, magnesium, there are little tricks to try and get around it. So Alzheimer's, the Bredeson's analogy is Alzheimer's is like a ceiling or a roof with 36 holes. You don't have to fix all of them, but we don't know which ones you need to fix. So start fixing them, and quite often you get to 10 or 12 holes that you fixed, and the person will suddenly improve. So this Dale Bredeson in America, he has trained specific doctors in America and throughout the world that follow his program. They know exactly how to use it. And there's actually a kind of algorithm where you put in all this data and it spits out what you need to take. So it's quite amazing. Now, I had a patient She hadn't seen me for at least 6 months. She lived like about an hour away from where I work. And her son suddenly visited her and realized his mum had been in the house for about 2 months, and the house was covered with mold. And she had lost her short-term memory. And she was convinced that her son was trying to rob her. In fact, he did give her car to his daughter, so that's another story. But anyway, she got so paranoid, she wouldn't believe the son. She kept coming to me, and I had big trouble getting her to follow any kind of program because she just couldn't remember. And the son wasn't happy for the mother to live with him so he could administer these supplements. Because if she'd done that for about 6 months, we would have reversed it. Okay, I want to talk briefly about sugar. So our body is designed to handle 3 teaspoons. Okay, that's like a quarter can of Coke. 3 teaspoons. Now, most of us have much more. So Australians have more than 30 teaspoons per day. Filipinos, Malaysians, and look at Thais, 28 teaspoons per day. So it's really quite high. So it's not just directly the sugar. It could be honey. It could be what's in cakes, pastries, lots of things. Basically, when we eat sweet, the sugar attaches to a protein and damages it. And all our body, we have lots of proteins as kind of chemical messengers. So we're going to be damaging our body eating too much sugar. Okay, so this is saying basically for Alzheimer's, you really want to be on a kind of lowish carbohydrate diet. If someone's actually got definite Alzheimer's, being on a proper ketogenic diet is useful. Now, in the old days, we used to test the urine to see if you're making ketones. But these days, you can get a little device where you breathe into and it tells you if you're making ketones. It's much more accurate. We all need a good fast. Has anyone done any fasting at all? How long? Up to how? Up to 8 days. Wow, give the lady a hand. That's fantastic. That's amazing. Fasting is quite difficult. And the reason we need fasting, so our body has a way of cleansing itself. Okay, it's called autophagy. So our cells kind of get rid of the bad stuff and get rid of it. And when we fast, our body does that even better. So for most of us, now I think if someone is like 80 years old and they're losing muscle, I'm certainly not going to fast them. And if I'm fasting an older lady, I'm watching her really carefully to make sure she's not losing muscle. Because with fasting, like what can happen, you can lose muscle. But if you do a fast for, say, 16 hours once a week, and then maybe once a fortnight, try doing a whole day, and maybe once a month, do 2 successive days. So I have a lot of cancer patients. The ones that can't afford to have the very expensive intravenous therapies, which will help them, I actually fast them. One very brave German lady, she read something in a book and she used to boil an onion in water and just drink the water. And she worked full time. She was some kind of fashion person in Sydney, driving around in traffic. And she fasted for 42 days. And she was married to a guy who was cooking curry and rice. And he wouldn't stop. And so he was cooking in front of her. But this lady fasted for 42 days and her cancer markers really came down. But for people, particularly people that are carrying extra weight, this occasional fast can be very useful. So the Americans are saying maybe every season, fast for 3 or 4 days in a row. So maybe 2 or 3 times a day, 2 or 3 times a year, do a prolonged fast. But if your muscle is low, please do not fast. You will not fast if you're pregnant, if you're breastfeeding, or certainly if you've got any evidence of muscle loss. I just want to point out coriander brassicas. So brassicas are like broccoli, collie, cabbage, spinach, bok choy. Those are really important detoxing vegetables. So for detoxification, we want to eat fiber. It's not so much just the quantity of fiber, but the variety of fiber. But these brassicas particularly are really, really good for clearing out lots of different toxins from us. And just remember, all of this is referenced. So if you want to look at the references, there is another version. Okay, so if you think you might have a problem with your brain, the first thing I would do is put you on this thing called CoQ10. So anyone taking a statin, statins lower CoQ10. Now in America, they actually give statins with CoQ10 on the one tablet, but the rest of the world hasn't quite caught up to that yet. And this particular form called ubiquinol, so it repairs the brain, it's really good for the heart, it's good for memory. So you should be taking at least about 200 milligrams normally, but if there's a strong family history, I'd go up to 300 or 400 milligrams. The downside of CoQ10 is it can thin your blood, so if you're on a blood thinner, be very careful. PQQ actually makes, so mitochondria are the kind of batteries in your cell that make energy. So for example, a heart cell might have 2,000 mitochondria. And this thing called PQQ is one of the few products that actually makes new mitochondria. So if someone's actually got dementia, this is very useful. But prevention, CoQ10 is what I'd start with. Life Seasons is one of Dr. Bredesen's brands, and that's a really nice product. And the last, so generally to prevent dementia, we'll talk about the diet, but in supplements, I would use the first one and the last one. So the Life Seasons Clarity, it's a really good multi, and whole coffee fruit extract. They're really good supplements for preventing dementia. So the whole coffee fruit extract is not coffee. It's much more sophisticated. Now, this was the thing called brain-derived neurotropic factor, which is increased by exercise. And these are some of the things that help you. So any kind of movement, it doesn't have to be running, but the moment you walk, you know, if you do a little bit of ironing, if you just do a little bit of skipping, blueberries are very important, but all berries are good. Dark chocolate, so the dark chocolate has to be at least 70%. And the Lindt 70% does not have dairy. Socializations are really, so all the ones in red are the important ones. So when you're mixing with people, so a big part of the Mediterranean diet, you know, we keep hearing the Mediterranean diet, but a big part of the Mediterranean diet is sitting in a group and eating together, that communal socialization, that's really important. We need to learn that. Curcumin is very important, but it's poorly absorbed. Now, this is very interesting. So in Sydney, there's this company called Singulum Health, and they've now got a branch in New Orleans, and I think they've got a branch in Zurich. So this guy does a fancy MRI, and he can work out which pathways in your brain are not working, and he can use magnets to repair it. So this is not just transcranial stimulation, but it's actually repairing these pathways that aren't working, diagnosed through a fancy MRI. This has only been out in the last 2 or 3 years, but I think this is one of the things that's going to improve brain health significantly. There's another thing called frequency-specific microcurrent. So naturopaths, some of the naturopaths know about it. There's a machine called a HOCAT, H-O-C-A-T-T, and that has a setting called frequency-specific microcurrent. And of course, hyperbaric oxygen. Breathing is really important. I'm not going to give you a big lesson on breathing, but we need to slow our breathing down. When we breathe fast, you tend to think you're going to get more oxygen in, but you don't. So you really want to take a breath. Let's do a little practice. Take a breath over about 3 seconds. Okay, so belly breath. So when you breathe in, your belly needs to go out. Okay, so breath in over about 3 or 4 seconds, then breathe out about 2 seconds longer, and then hold it for about 2 or 3 seconds, and then repeat that cycle. So it's a little bit like that Buteyko breathing that's really good for asthma. But when you slow the breathing down, you actually absorb more oxygen out of the air that you're breathing. Okay, exercise is very important. Okay, so we are basically sitting ourselves to death. You know, we go to work, we sit down, we don't really move very much. That's one of the reasons these stand-up desks have become so important. But any kind of movement is going to help. So particularly my patients that have the insulin resistance, I get them to do any kind of movement for 10 minutes. Now another tip of today, again, these are always Americans. There's a guy called Dr. Zach Bush, B-U-S-H, Zach Bush, and he's got the 4-minute workout. And we did this experiment on a lady. We checked her blood sugar. We did this 4-minute workout, and her blood sugar dropped by 2.5 points, which is quite significant. So particularly when people are eating something naughty, they can do the Zach Bush 4-minute workout that's on YouTube. Please have a look. Certainly brain exercises are very important. So all of these you can do. So this is his summary for actually treating. So he claims 84% of his patients improve, and that's the guy, Bredesen, Dale Bredesen. So he puts them on this diet. He makes them exercise. He optimizes their sleep. Make sure you're doing a lot of joyful things. And particularly for my cancer patients, you have to have a reason to live. If you're living on your own, you're going to get more depression. And if you've got cancer, I can tell if someone comes to see me with metastatic cancer where it's spread everywhere and they don't come with somebody, I know that's a lonely, sad person. They're going to die quickly no matter what I do. But when they come with their spouse or their child or their grandchild, you know that person's going to do better. So socialization is really very, very important. And having this joy, you've got to find some joy out of your life. Specific computer games, detox we talked about, and I mentioned those two things, particularly the clary tea and the whole coffee fruit extract. Okay. So let's talk a little bit about prevention. So you really, if you're concerned about dementia, yes. For the specific computer games for cognitive training, yep. Lumosity. I've got put a few names up there. You'll find it on one of the slides. Lumosity is particularly one that's very good, and it's free. Lumosity, Lumosity. Okay, so I think for people that are concerned about dementia, at least get this test done. So particularly if you could do that test when you're kind of, say, 50 and you know you've got it, then there are things we can do to try and prevent it. We're going to make sure you're sleeping properly. We're going to make sure you're not eating too much sugar. We're going to make sure you're doing some exercise. Go into a forest, hug a tree, walk on a beach. Wet sand is really good for grounding. And if it rains, put your feet on the grass. I would certainly check them for insulin resistance. I do a lot of hair testing on my patients. And again, this is another American company, Doctors Data. We certainly want a lot of unstructured time. We want time where we're not doing something all the time. Unstructured time is really important. Yoga, games, socializing. In the diet, there's no gluten or dairy, and certainly limiting sugar and having regular protein. And as we get older, the protein needs to be slow cooked. So when I say slow cooked, I'm talking maybe mince if you're eating meat, or a slow cooked leg of lamb. If you're eating plant proteins, you're going to look at nuts and seeds. Eggs are really good protein, but if you eat eggs every day, you eventually get allergic to them. So maybe have eggs 2 or 3 times a week. I think bioidentical hormones are very important. So these days we can give hormone replacement, which is like a cream, and we can use saliva tests to work out the dose. And there's now research showing, and I've got references on the other version, showing why bioidentical hormones are safer than normal HRT. Now, this was a big study. This was not Bredesen, this was a British study. They looked at sort of 350,000 people. And in this study, they said having too much alcohol, but in this study actually said having no alcohol was an issue. I'm not quite sure, but that's what the study said. And if you have less education, you're higher risk of getting dementia. Isolation, ApoE4 homozygous, which we've talked about, inflammation, low vitamin D. So diabetes goes with the insulin resistance inflammation, depression, stroke, cardiovascular disease. Because if you've got cardiovascular disease, you've got inflammation. Just remember, all diseases start with inflammation. Hearing impairment. So hearing impairment can happen quite early in the dementia progression. And reduced muscle. So I talked about this before. Sorry, can someone, you just hold the mic for me, just for one sec? So if you just look at, if you look at your hands, just have your hand just relaxed. If there's a gap in there, you've lost muscle. So you've definitely lost muscle, so have you. You're not too bad. And if you look at these young guys, they're really completely filled in. They haven't got gaps between these muscles. So these are called the interossei, they're kind of hand muscles. The other test is if you're well hydrated, press your thumb and let go and it should bounce straight back. If you're well hydrated and it doesn't bounce back, then you've got a problem with muscle. Now, you mind if I look at your hand?
No, mine doesn't bounce back.
It does not bounce. In fact, before, this lady's got vertical lines on her fingers, which are really bad. Okay. So once we get to a certain age, I'm the same, so I'm not picking on you because I've got the same thing. Once we get to a certain age, I'm over 70 now, once you get to a certain age, you are going to lose muscle. I actually eat protein, I take enzymes, I do exercise, and it's still a bit of an issue.
Can I ask about the theory here? Is that sign that you develop Alzheimer, or is it?
No, there are many causes. Is hearing definitely going to progress to dementia? It's not. So there are many causes for loss of hearing. The commonest one would be recurrent childhood infections. If you had a lot of infections, you had glue ear, maybe they put some kind of little instrument in your ear to kind of drain the pus. Those people are going to get hearing loss earlier. There might be someone who's exposed to a lot of loud noise in their work, jackhammers. You see a lot of people working in Asian countries not wearing any protective gear, jackhammers, lawnmowers, not using that kind of stuff. So they're more likely to get hearing. But hearing can be part of Alzheimer's. It's not definitely, not guaranteed. Okay. I'm just going to very briefly talk about this because I want to open up for questions. So if you've got a history of high blood pressure and you lose memory, that is called vascular dementia. It's not Alzheimer's. Alzheimer's is the rest. Basically, if you've had a history of blood pressure and you get Alzheimer's, that is, and you get dementia, that is vascular dementia. And the main treatment for that is something called melatonin. Now, we know about melatonin for jet lag. So again, there's lots of references for this. So we know about using melatonin for jet lag. So it's really fantastic for jet lag, but it's a miracle for dementia. So melatonin is probably the best antioxidant for the brain. It actually anti-ages your brain. Is there any advantage of the instant versus the time release? So if you're having trouble falling asleep, then you want the instant one. And on the internet, you can actually buy one that dissolves under the tongue. It works in about 10 minutes. If you're someone who wakes up at 2 or 3 o'clock in the morning, this is complicated. If you wake up and you're brightly alert, you're ready to go, that's a sign that your blood sugar has dropped, your adrenaline has kicked in, and it's made you incredibly awake. Then you've got to address the blood sugar issue. But if you wake up at 2 or 3 in the morning and you're kind of just a little bit, then that's when you need the slow release melatonin. So in cancer, we use very big doses. So for someone who's never used melatonin, might only start them on, say, 0.5 or 1 milligram. Generally, if you're 70, the maximum dose I would use would be 7 milligrams. So melatonin will give you vivid dreams. But if you start to dream that someone's chasing you to kind of stab you, then you're having too much. You need to cut back. Okay, so that's a good sign you're having too much. Yes?
So with the melatonin, you're talking specifically about vascular dementia or all dementia?
Sorry, say again?
Sorry, with the melatonin, are you talking specifically about vascular or all?
No, for melatonin, I'm talking specifically for vascular dementia. Yeah. But it's still good for all brains. So I think after a certain age, I wouldn't mind putting everyone on melatonin, really. But how many things are you going to take? I think the most important thing we all need to make sure is our vitamin D is a good level. Vitamin D is number one. It affects some more than 600 different genes. So vitamin D is by far the most important one. And get decided that normal range is not necessarily normal. You want to be optimal. So you want to be high end of the normal range. Yes, sorry, question at the back? Put it close. Yes, you can definitely use it preventatively. Absolutely. So melatonin is so anti-inflammatory. So my patients that, again, I keep going back to cancer because that's what I'm doing mainly these days. People having chemotherapy and radiotherapy get a lot of inflammation from the treatment. And melatonin is really good for reducing that inflammation in the brain. Anyway, you can read through all of this. And there's many pages on, and all of these are referenced. Every single statement has got a reference. So if you want the detailed one, ask Gopal. And the bottom one's a little bit about fasting. Now, the last thing I want to talk about is this product. This is a Chinese herb that also reverses vascular dementia. And we actually now have a study showing that. So there's an Australian study. It's called Salyotong. I don't know the right pronunciation, but it's abbreviated to SLT. But it definitely is a Chinese herb that works for reversing vascular dementia. So try and do that test yourself, the Apollo Health test. That's a free test. But remember, you've got to be doing that regularly. And that's it. Questions?
If you were going to have a late night snack, what would you eat?
If I was going to have a late night snack, I would want to have something with some fat and some protein. And so nuts are going to be really good for me. So something like, macadamias or even almonds. So almonds and walnuts particularly protect the DNA, but macadamia is a really good fatty protein kind of nut that'll fill you up for a bit longer.
If you added half a banana, would that ruin the whole thing?
If you added half a banana, would that ruin the whole thing? If your banana was fairly firm and not going black, yes, it would definitely help. So when the banana is a little bit unripe, the fiber is fantastic. That's why they give you these raw mango salads and raw papaya salads. So when the mango is quite firm, it's a fantastic fiber. Once it starts to get a bit yellow or get black, it's great for making a cake. Oh, sorry, the banana. It gets really black. Then it's really good for making a cake, but it's really full of sugar. It's very high sugar. Yeah. Now, generally, sugar is not necessarily that bad. So someone who's really slim, can you stand up, please? Now, if you look at this gentleman, look, he's slim, he's muscly. This guy can have whatever sugar he wants. He can stay awake till 2 o'clock in the morning and he's going to be healthy. Thank you. Okay, so it depends on the body shape. So a lot depends on your diet, your sleep patterns. So in terms of diet, we need to be eating protein. We need lots of fiber. We keep talking about omega-3s, but we're finding that when people have seafood more than twice a week, their mercury starts to go up. So be a little bit careful with seafood. The seafood needs to be wild caught and needs to be small fish. Once you're eating tuna and mackerel and snapper, they're high mercury fish. Now, if you did that once a fortnight, once a month, I don't think it's an issue, but don't do it too often. And so going back to your question about the banana, if you've had a meal, you've had maybe an entree, maybe you had your meat and had some vegetables, and then you have something naughty, it's actually not so bad. But if you have the naughty thing with a cup of coffee at 10 o'clock or 11 o'clock, that's going to make your sugar and insulin go up. That's really bad. Yes, sorry.
You said the body can only handle 3 tablespoons of sugar?
No, I'm not saying it can only handle. It's designed for that. So, for example, if you go to a gym and you exercise, you're going to break down maybe 15 teaspoons of sugar. Or if you're doing manual work, you're going to break it down. But the average person has been designed, their body can only handle 3 or 4 before, over a period of time, that will start to build up. So maybe not at 20 or 30, but once they get to 40 or 45, if they don't start cutting down that sugar, they're going to put on weight, get visceral fat, insulin resistance, type 2 diabetes. And once you're diabetic, your risk of dementia goes up, but your risk of cancer goes up, your risk of stroke goes up, your risk of heart attack goes up. So you really want to keep that sugar and insulin level down. Depends. So if you're having low glycemic load fruit that's low in fructose, then it's not an issue. But there's some fruits that are very high in sugar and very high in fructose. So we're finding that fructose is probably worse than just plain sugar. So when you eat a piece of fruit and you're eating the fiber, it's not going to be quite as bad. But when you juice it, that's really bad news. But generally, berries, cherries, as I said, here papaya and watermelon, not a problem. But for someone who's got a problem with their weight, eat your protein and fat and have the fruit at the end of the meal, or have your protein and fat and have your sweet thing at the end of the meal. More questions, please. Yes.
What's the protein intake for 65 plus?
What's the protein intake for 65 plus? That's a very intelligent question. So if you want to look up on the internet, there's a really smart cookie called Walter. It's like Walter, but it's spelled with a V for victory. So Walter Longo, he's done a lot of research on protein, and he feels that when we're younger, we should eat, in fact, a little bit less protein. So when we're a little bit stressed, we actually thrive better. And when we eat a little bit less protein, we actually do a bit better. But once we get older, we need more protein. So for example, when you're past 60, you need something like 1.4 grams per kilogram of body weight. Normally we say 1 gram per kilogram, but I think when you're getting older, you need more. But now if you're a gym junkie and you're going to the gym 6 times a week, or you're doing marathon running, then you need to eat a lot of protein. And the important thing is women that are pregnant definitely need more protein, but women that are breastfeeding, for breakfast, they need to eat like about 10 eggs. And I know that's not going to happen, but women that are breastfeeding lose a lot of muscle. So they really have to bump up their protein intake.
So give them a really good breakfast. Make sure they're having a morning tea, a good lunch, and afternoon tea. So breastfeeding women lose a lot of muscle. So be a little careful with that, particularly when they've had more than 2 babies. The first baby is not so bad, 2 is not so bad, and the third one, blame number 3. He's the cause of all the issues. For over 65? Well, it depends. If she's had many babies, I would probably even go up to about 1.8 or 2 grams, like an athlete, 2 grams per kilogram. But if she's only had 1 or 2 kids, I would probably go up to about 1.4, 1.6 grams per kilogram. But each time I do that, I'm always looking at them. I'm looking to see, are they losing muscle? There are special things in the blood test you can see. So there's a kidney test called creatinine, as opposed to creatine. Creatine is the stuff they use for building muscle. But creatinine is a kidney test that gives you an idea of how much muscle you've got. And there's a liver test called albumin that gives you an idea of how much muscle you've got. And if there's another blood test called uric acid, if that's very low, you're not eating enough protein. So you want your uric acid in the middle of the range. Yes, at the back. Close.
I'm curious about integrative GPs and how you might practice as distinct from regular GPs.
Did you come in late? Did you come in late? Okay. Okay, so a normal GP, if they see someone with pneumonia, is going to give them antibiotics. If they're really sick, send them to the hospital for intravenous antibiotics. Now I'm going to do the same thing, but I'm going to ask, why did she get pneumonia or he get pneumonia in the first place? Is their vitamin D very low? Were they not eating enough vitamin C? Is their zinc very low? Was there some major stress that happened? Have they got some kind of toxicity, like mercury toxicity? So we're looking at the terrain rather than just killing the bug. So for example, if I see someone with cancer, I hope I'm not bringing you up by talking about cancer all the time, but I find 8 years before the cancer, these people have had some major stressful event, death of a child, maybe change of job, but some major stress. Then on top of that, they've got mercury fillings. 90% of my patients with cancer will have high inflammation. So they'll have some issue with pre-diabetes, insulin resistance, visceral obesity. So there'll be inflammation, stress, mercury, maybe not sleeping properly, maybe a genetic tendency, maybe some other toxicity that we haven't discovered. So there's often multiple factors. So I had a Filipino lady that I saw many years ago, and she was a very slim, thin lady. And her husband was reasonably muscly, and he was spraying stuff, like not Roundup, but chemicals in the house. And he was fine, but she washed his clothes every day. And because she was so slight, she got the cancer from toxicity. Yeah. Yeah, at the back first.
A couple of questions. One is optimal vitamin D.
Optimal vitamin D. Whatever your range is, you want to be in the top end of the range. Are there any doctors in this crowd? Sorry? Basically, if you've got the vitamin D at the right level, there's a thing called parathyroid hormone, and that'll suppress the parathyroid hormone. That's when you know you've got enough vitamin D. And if you want to look it up, it's called the Coimbra, C-O-I-M-B-R-A protocol. But basically, you want your vitamin D in the blood test to be in the upper end of the range. So in my lab, it's 50 to 140. So 51, 50, even 70 is not enough. I want my patients about 100. But if they've got cancer, I want them at about 120.
What dose of vitamin D?
No, the dose is the dose that's going to get you that blood level. So what dose? No, I don't know the dose. So because I'm darker skinned and older, so vitamin D hits the skin, cholesterol becomes a type of vitamin D. It goes to the liver, it gets activated, then it has to go to the kidney and be activated. And once we get all of that, enzyme doesn't work. So that process doesn't happen. Plus I'm a bit darker, I just don't get it out of the sun. So I take 10,000 a day. And I'm not recommending everyone take 10,000 a day, but just check a blood test and then maybe. So most white people generally need about, in winter, probably about 2,000 or 3,000 IUs a day. In summer, 2,000 or 3,000 IUs a day, and in winter, probably double that. So in winter, because we don't get sun, you need to double the vitamin D intake. You had a second question.
Removing mercury fillings.
Removing mercury fillings has to be done by a holistic dentist. Because if they don't use something called a rubber dam, the mercury just goes straight through your nose into your brain. So they actually use a rubber dam. Now, a normal dentist, this is not an integrative dentist, not a holistic dentist. When they're touching mercury, they're using gloves. They've got a mask on, but they're putting it into your mouth. So when it's being taken out, they have to use this thing called a rubber dam so it doesn't leak. They have this special kind of suction that takes it out of the room. And straight after it's done, I actually send my patients for a squirt of intravenous vitamin C. Intravenous vitamin C, oral doesn't work.
What do you recommend if they either haven't used it or something's gone awry?
Sorry, if they?
So I insisted on it being used, and
The rubber dam.
Yeah, and there was a hole in it. I could feel it.
Okay, so there was a rubber dam used, but there was a hole and you could feel it. Was this a dentist you knew?
I didn't go in there anymore.
Yeah, obviously, yeah. I don't want to be horrible to the younger people in this crowd, but my wife at one stage needed an operation. And when we saw this doctor, he didn't have a single gray hair. I said to him, sorry, you're too young. I can't let you operate on my wife. You want someone with a bit of experience. You want someone who's done that operation at least 200 times. You don't want to be the 20th patient. So maybe you were the 20th patient. You want someone who's got experience. So there's nothing like a little bit of gray hair, you know, someone who's done the job for a long time.
In terms of the exposure, is there something you can take?
Okay, if you've got if you think you've had some exposure from that mercury, if the rubber dam broke, you could do a blood mercury test because that gives you an idea of the recent exposure. But you can do a hair analysis that tells you what the exposure has been like over a period of time. So you could do a blood test. And in the blood test, do not accept the lab's normal. Any level of mercury is toxic. Any level of lead is toxic. Because what happens to mercury normally when it's in the blood, the organs suck it up. So it doesn't stay in the blood for very long. So if it's in the blood, it's high. Do a hair test. And the best thing for getting rid of mercury, make sure, again, drinking filtered water, eating lots of fiber. You've got to open your bowels every day, and then using chlorella. So there's a thing called chlorella, which is a really good binder, and you've got to take big doses of chlorella. 1 twice a day, then you take 2 twice a day, then you take 10 twice a day, then you take 20 twice a day for about 2 or 3 months. Stop taking it. Wait 2 months, check the hair test, and you'll find that it'll have come down again. Your mercury will have come down. Is what?
A similar amount of mold exposure.
Chlorella and mold. No, chlorella doesn't fix mold so well. Mold is a lot more complicated. So for mold, you need, it's making me struggle. For mold, you need something called a binder. So our body has this crazy system where when we make bile, the bile goes down the bowel and we actually reabsorb it and reuse 90% of it. Now, if we put a thing called a binder, and the best binder to start with is something like activated charcoal, it binds this bile, we poo it out, and then our liver has to make fresh bile. And over a period of time, it gradually brings down the mold. But there are lots of other things you've got to do. They've got to be on antioxidants and quite a few other things.
I've seen that you mentioned also root canal. What is an alternative to root canal when you use it?
Do not have a root canal, please, because the root canal is always got some smoldering infection. And smoldering infection will give you something eventually. So if there's a root canal, take out the teeth and put a zirconium implant. You don't want any metal in your mouth, because if you have metal in your mouth, it ends up being a little battery in your mouth. But if you get zirconium, and there are not many dentists that do zirconium. Again, but get an opinion from a dentist. I'm not a dentist, but if I have someone with a root canal, because we know that cancers can be associated with root canal, heart attacks. So when you have a heart attack, the actual little clots, they're actually finding stuff from the root canal in that clot in a heart attack.
We'll do one last question and then we'll get another question.
Jasmin, you researched that a high dose of magnesium is helping Alzheimer. Have you heard that?
Yes, so the high dose magnesium helping Alzheimer's. So my first product that I put up there was called magnesium threonate. So threonate is a form of magnesium that specifically gets into the brain. So the brain has this covering called the blood-brain barrier, and magnesium threonate gets into the brain, so it's fantastic for the brain, for memory, for any form of dementia, but particularly Alzheimer's, yes.
And the dose has to be 500 milligrams and above? Or?
No, the dose is the dose that works. I can give you a starting dose, but the doctor has to be a scientist. You give the dose, watch the patient, do you improve or not? Because the problem with magnesium, it gives a lot of people diarrhea. So start in a small dose. So I like magnesium powder. I would put it in a big bottle, shake it up, so they're sipping it through the day. So whenever you're stressed, you pee out your magnesium. So most of us are actually deficient in magnesium. Any lady who gets sore boobs just before a period, they are deficient in iodine. That's another very common one. So iron's the commonest one. Iodine's very common. Vegetarians are definitely going to be low in iron, B12, zinc, hormones. So there are all these different things you can look at. So when you go to an integrative doctor, again, these are all American stuff, but they've generally done much more study. I must read a book a week usually. So we try and keep up to date. Yeah.
All right, well,
Look, I'm still here for a while, so if you've got any individual questions, I'm still happy to take it. Okay.
That's very kind of you. Thank you so much, Dr. Ashley. And thank you, everybody. And so great insight. And I think, the talk would have gone for a couple of hours, but I think we're going to end there. Thank you very much and have a nice evening.